In health news this morning, most of us have heard about the dangers of arteries being narrowed by fat and cholesterol and the deadly impact it could have on your health. And while many of us have also heard about angioplasty or the placement of stents, for some who are suffering from complex coronary artery disease, there's an even more advanced procedure called protected PCI, offered right here in West Michigan, that could save a life. Here with more is Dr. David Wones. Good morning, doctor.
Good morning, Todd.
So for those of us who have no idea what that stands for, protected PCI, could you explain what that is?
Okay, great question. So PCI, percutaneous coronary intervention, that's the stents and angioplasty part. That's what we do to open up these arteries. Okay. It's a generic term that covers both.
Okay, so that, and most people are familiar with that. That's a balloon,
so
right?
A balloon goes into the artery. If there's a blockage, the balloon breaks it out of the way. 95% of the time, the balloon is paving the way to get a stent into the artery, because the stent is a far more definitive treatment.
And the stent is like a sleeve?
Stent is like a metal coil. It's actually an incredibly complex medical device, but it's a metal coil that acts as a scaffold. It's got a polymer and then a drug on it. So you push the blockage out of the way, and then that drug that's on there prevents blockage from recurring in there. So it's a far better, durable treatment than balloon angioplasty alone. So most interventions, the PCI part, are stents.
Okay, and that's truly amazing, by the way, that we can even do these things that you're talking about.
It is incredible. It's been fun to watch this technology evolve over the last 30 years. The protected part refers to supporting this patient while they're getting this procedure, and specifically refers to an impella pump that can take over for the heart's pumping action. So again, very small device. You know, not much bigger than the pen in my hand, but you can see that.
We're seeing a shot of it right now. So this is the procedure.
In about 10 to 15 minutes, we can place the patient on this pump. It can pump 2.5 to 3.5 liters of blood. And so this protected PCI, it's really for our sickest, most vulnerable patients, where historically we might not even be able to take care of them. We may not be able to offer them therapy.
And that was my next question, who's eligible for that?
It's two groups of folks.
Okay.
One are patients that are in shock. So they're having a heart attack typically. They're very sick. And they're in shock, which means the organs, the brain, the kidneys, and so on, are not getting proper blood flow.
Okay.
This device allows them to get blood flow to everything, supports the heart, it offloads the heart, so the heart doesn't need to pump as much while we restore the circulation. The other group, and this is the protected part a little bit, is our patients that may just have one blood vessel remaining, or their heart is so diseased and so many blockages that while we're doing the work they can deteriorate. The pump prevents that. It protects them so we can get the job done to restore the circulation. We've been doing this for almost 10 years, but it's evolved over the last 10 years. We were one of the first to do this in 2008 when the device was released, and we've learned who benefits more than ever. So the program has grown, and our ability to offer this to more and more patients as we've understood how this device helps them has been incredible and transformative.
It's always fascinating to have a guest like you on our show, because you actually have your hands right there inside of in people's bodies, saving their lives with this type of technology and advancement. The impella pump is what we're talking about. That actually takes a little bit of a load off of the heart. So somebody might need more information. They may know someone who's maybe a candidate for this. How do we get a hold of you? And is it true, by the way, before we get to that information, is it true that only certain hospitals offer this? I mean, we're kind of in a special area, again, blessed to live in West Michigan.
Yes, and actually the state of Michigan is an interesting state in that the state regulates some of this. So this kind of therapy is really only offered in hospitals that have surgical programs as well as cath-based programs. So in West Michigan, being able to get a procedure like this is uniquely at a place like the Meyer Heart Center. And that's in part how the state manages this, is we want centers of excellence that do this, not once a month or a couple times a year, but once a week or many times a week, and has a lot of experience. And it really takes, this isn't just about a procedure. This isn't just about the cardiologist or the surgeon. This is about a team of people taking care of that patient and surrounding them and everything they need. And that's part of, when we think about protected, it's not just the pump, but it's about a team of experts providing the care.
Thank you so much for the information this morning, Dr. Wones. If you want to schedule an appointment or learn more information about this, there's a toll-free number, 855-7, and My Heart. Or if you're on the net, spectrumhealth.org/cardiology. cardiovascular. Thanks again, Doctor.
Thank you, Dad.
Appreciate it.
Appreciate
We'll be
it.
right back.